welcome to our next episode of Medical Minds. In today's show, we have our topic, and we are basically going to look at fertility treatment options. Just in case you're there wondering what it's all about, Doctor is already in the studio to give us all the answers. Welcome to the show. We've been looking at different topics from the time we started, and we did not look at how to treat infertility in both men and women. So today we've decided to look at that topic, and Dr. Andabati is back on the show to give us all the answers that you've been looking for. Welcome to the show once again, Doctor.
Yeah. Yes,
say hello to the viewer.
Yes, good evening, viewers, and welcome to the show.
Thank you so much. Doctor, we go straight to our topic, and we've been looking at infertility in women, in men, and we've not been giving them a way forward as far as that is concerned. Yes, and this is exactly why we are here today. Before we go into the treatment options, kindly remind us briefly what infertility details.
Yeah, so infertility, just to recap, when we talk about infertility, we mean that the couple has been trying to conceive without using any means of contraception for about 12 months, and they are not getting the pregnancy that they are looking for. Yeah, in the basic terms, that is what infertility is. As you can see, it is a problem, and previously we discussed a bit about the causes and some different aspects of infertility. So, because the biggest interest is to try and solve the problem of infertility. And so today we will just briefly outline, because the methods of treatment are quite numerous. And this is a hope raiser. We will discuss this briefly, and then we will later dig deeper.
Thank you.
Some later shows.
Thank you so much, Doctor. Do we have types of infertility, or it's just one?
Yeah, okay. So in terms of types, depends on how we, in clinical practice, depends on what we are looking for, because we can classify them according to their causes, we can classify them according to whether somebody has had a pregnancy before, now they're not getting. This is the commonest. So we broadly can classify infertility into primary and secondary.
So which one is the primary?
So in a primary infertility, that means the person has not had a pregnancy before, and now they are looking for a pregnancy and it's not coming.
They can't get the baby, yet they've never given birth.
They have never given birth before.
Okay.
Yes. And the secondary infertility, they have had a pregnancy before, whether it resulted into a baby or it ended up as a miscarriage, but then now they are having challenges with conceiving.
Okay.
Yeah, so this is the difference, primary and secondary. The definitions, the differences have some clinical implications. Yeah, but these are the two broad categories.
Okay.
Yeah, and then we can also talk about according to the causes of infertility, for example, tubal infertility, male factor infertility due to sperm problems, or infertility resulting from a problem with the womb.
Okay.
Yeah, so those are how the ways in which we can classify them.
Can classify them.
Yes.
Those two of the two types, Doctor, which one is more common of late?
We are seeing more commonly secondary infertility, actually. We're seeing secondary infertility common. At some point, they were balancing, but now we are beginning to see secondary infertility being more common. Somebody has a pregnancy before, maybe it ended up as a miscarriage, but now they're having challenges with conceiving.
They can't.
Sometimes they are not, the couple are not, especially the lady is not volunteering the story. But if you dig deep,
so sometimes we keep away the secrets,
and
we keep thinking it is the man.
Yes.
Yet we know in our previous years
something
what we did.
There.
Surely,
yes,
true,
yes.
true,
that's true.
Which is very important, because when you hide away that factor, there is no way.
And then you might take long to be helped.
True.
Yes.
Thank you so much, Doctor. Let's go straight to our causes of these different, these primary and secondary, before we look for the symptoms out.
Yes. Yeah, actually that's a very good highlight for us to start with, because the main discussion today is the treatment, but the options of treatment are based on the causes. So it is important to briefly outline those for sure.
Okay.
So in terms of the causes, broadly, infertility may result from a problem in the man, or it may be a problem in the woman, or it may be a problem in both. On the side of the man, usually it is a sperm issue. Either the sperm count is low, or the sperms are not there at all. Yes, so there's an issue with the sperm. That's usually one of the issues in the men.
Okay.
But now on the side of the women, it can be something to do with the tubes. The tubes are either blocked.
That is the primary, when the lady had never conceived at all?
So
or
all these causes can happen.
across.
Yeah,
Okay.
all these can happen in the primary case or in the secondary case.
Okay.
Although some of them are more common in the primary, and then there are others are more common in the secondary.
Okay.
But in terms of the causes, usually we look for the same causes. Whether it is the primary one or it is the secondary one, we look for the same causes.
Okay.
Yeah, so it could be a problem of the tube, or it could be a problem with eggs. The woman is not having eggs, or the eggs are of poor quality, or it could be a problem with the womb. Some people have had the wombs injured, and so the womb cannot hold a pregnancy.
Due to infections,
yeah,
different
due to infections, due
abortions.
to surgeries, due to abortions, and so, yeah. Some people are born with abnormal wombs.
Oh,
Congenital
really?
abnormalities of the womb, we are also beginning to see them.
To discover it.
Yeah, somebody has something like a curtain, or we call it a septum, dividing the womb into two parts. Unfortunately, that septum does not have enough blood supply. So if the baby attaches there, it won't be able to grow.
Okay.
And if that happens continuously, and then the person may not have a pregnancy.
Sorry.
Yeah.